I want to talk about stigma because it seems to be the main stumbling block as to why people don't want to actually come forward and get tested. People say that their biggest fear is that somebody else is going to find out, or the community is going to find out, and what's going to happen then is there's going to be all sorts of fallout. People are going to point fingers, there's going to be gossip, there's going to be all sorts of stuff going on, and there's actually a lot of truth in that. The reality is, however, that people need to stop and just think through what they're actually claiming as being the problem or the limitation as to why they don't want to come forward and get tested. The way I see it is that a person can hide being HIV positive for probably 5, maybe 6, 7, 8 years, depending on how well they look after themselves. At some point, however, they are going to start getting sick. They're going to start losing weight. They're going to start actually showing physical signs. And let's not fool ourselves for a moment that people in the communities are stupid, because they're not. They will notice, they'll see the hair loss, they'll see the rashes, they'll see the weight loss, they'll see a whole range of issues that will lead them to believe that that person has HIV, AIDS, Slim's disease, slow puncture, whatever you want to call it. They will arrive at that conclusion. And at which point in time, for the next 2 to 3 to 4 years, assuming that person does not get on antiretrovirals and doesn't seek help, which is what a large portion of the population are doing, and sadly dying as a result of it, if they don't come forward and get that test, what's going to happen is their very worst fear is actually going to become their reality. They're literally going to create that, because people will talk, they will point their fingers. So the only way to circumvent that, and the only way to actually overcome this obstacle of so-called stigma, is to go and get tested. Get tested as early as you possibly can, and work with your healthcare provider to ensure that you stay healthy for as long as possible. And at the point that you do need the antiretrovirals, find out where you can get them, make sure that you have a constant supply and access and all the rest of it. And reality is that people don't even need to know you're HIV positive, because if you do what you're supposed to be doing, and taking care of your body, taking your medications, looking after yourself on all levels, bottom line is nobody ever needs to find out unless you choose to tell them. That's really entirely up to you.